Hello, everyone. Welcome to our wellness webinar off our weekly schedule, but this is a special one here today. So I am Stasi Kasianchuk, and I am a registered dietitian, nutritionist, exercise physiologist, and director of Gennev's Health Coaching, and excited to be here with another Gennev, part of the Gennev company here, Dr. Rebecca Dunsmoor-Su. And I'm going to let her introduce herself, but as a reminder to our participants for a couple of things, we do take questions throughout the conversation. And I think this one especially, we're going to be talking about personal protective equipment for you while we're all embracing this pandemic and how to best protect yourself. So as questions come up, go ahead and place them. If you're on Zoom, place them in the comments or the Q&A box. And then if you're on Facebook, you can go ahead and just thread those in the comments below the live, and we'll address those throughout the presentation. We'll also allow some time at the end to do that. So Becca, go ahead and introduce yourself to our audience and let us know your role here at Gennev.
Sure. I'm Dr. Rebecca Dunsmoor-Su. I'm an OBGYN and menopause specialist out here in Seattle, Washington, and I'm the Chief Medical Officer for Gennev. And I'm thrilled to be on our webinar series today. I'm happy to talk about personal protective equipment, what makes sense, what doesn't, how to use it correctly, but also many of you don't know, I also sew. I mean, I am a surgeon, so I sew bodies, but I also sew fabric. And so I have been making a lot of masks myself, both for my own personal use, for my family's use, and for others. We're actually sending some to the Navajo Nation soon. So can go over some good patterns and some things to look for in a mask.
Excellent. This is perfect. We're glad that you have multiple areas of expertise, medical background, sewing background. You might be getting a lot of questions here today, Becca. All right, so let's start with what is PPE. I don't know that many people would know if, 5 months ago, if you said PPE, if many general population would know what that is. So let's start with the basics. What is PPE? What does it stand for? And why is it important now when wasn't as important 5 months ago?
Right. Well, I'm not even sure that if 5 months ago in the medical community, we would have necessarily called this PPE or that phrase was that going around that seriously. PPE stands for personal protective equipment. And it's not a medicine specific phrase. A jock cup is personal protective equipment. It's anything that protects your body from something that could hurt it. In the medical field, what we generally refer to as PPE are things like face shields or masks or gloves, things that protect you from coming in contact with things that could harm you or infect you. What we've sort of come to understand as PPE now are more complex masks and face shields and things. The ones we in the medical community need are the ones that actually prevent us entirely from breathing in virus. So what we call an N95 or a respirator. The face shield so we get no splash, and then, gowns and suits and things like that for highly infectious situations. But to the general public, it just means anything that's going to protect you.
All right, excellent. So with the COVID-19 pandemic right now, why are we talking about general public and wearing these equipment, this personal protective equipment?
That's a really good question, because in general, if someone has COVID-19, they should not be out in the general public. And in most of the places where you'll be watching this webinar, not all, there is a stay-at-home order. So most of us are not supposed to be out in the general public. That being said, there's only so much we can stay at home, right? We need to get groceries, and not everyone can do Amazon Fresh. Not everyone lives in an Amazon Fresh area, but also nobody can get a delivery date anyway. And so there's certain things we do have to go out for. And when we do go out, what we want to do is protect ourselves and protect others from us. It's a combination of things. So wearing a mask is not only about protecting yourself, but it's about protecting others from you.
Excellent. Yeah, so two-way street there.
It's absolutely two-way street.
Yes. And can you talk about, you made the point that if you have COVID-19, obviously you should be quarantined, you shouldn't be going out. So protective equipment, is really for people that are asymptomatic, that don't, to their knowledge, have COVID-19. Can you talk more about why that's important?
And that's really important. We do not know what the asymptomatic carrier rate is. We know there is one. but we do not have universal testing. So we fundamentally don't know who all has this virus or carries it. What we do know for sure is even people who will become symptomatic are asymptomatic for 2 to 5 days where they're highly infectious ahead of time. There are some people, especially children, who may never show any symptoms and can be infectious for 10 to 20 days in that state. So just because you don't have a cough does not mean you are not carrying the virus.
And now when it comes to the PPE for this specifically,
Mhm.
can you talk about, why we need to be wearing it if we're asymptomatic and how that's transferred?
Yes. So what we know about COVID-19 is it is absolutely fundamentally transferred by droplets. So that means like spit. So cough. When we're talking, we make droplets all the time that land on other people, whether we want to think about that or not. Things like that. But there's a certain amount of it that also gets aerosolized during certain situations. So when you're running or breathing heavily or coughing, it's not only coming out in droplets, it's actually coming out in such tiny particles as basically in the air you breathe. And it can linger in the air around you for quite a while in that situation. In fact, we were just chatting before this webinar. There's a graphic I meant to send to Shannon so she could put it up, but I'll try to find it and get it into the follow-up letter. There is a great graphic out there, which I'm not sure how much science it's based on, but it makes intrinsic sense, where you have two people facing each other. And if this person has COVID and they're wearing a mask, there's a very low likelihood of transmission because everything that they're breathing out is getting caught right here in front of their face. And so it's going down and it's going out to the sides, but it's not going forward. If this person still has COVID, but this person's wearing a mask, there's a much higher rate of transmission because they're coughing this all into the air around you and we breathe around the mask, right? But if both are wearing the mask, there's probably less than a 5% chance of transmission. And so even if somebody who is asymptomatic and doesn't mean you any harm is out in the world doing their grocery shopping, but you're both wearing masks, you're much less likely to get sick from them.
That's such a good point. The collaborative effort, all of us
Yeah.
doing our part.
Exactly.
Well, let's talk about masks. We've seen there's a lot of different masks out there. For a while, we were hearing that there's shortage on masks, and now there's fashionable masks, and we can sew our own masks.
Yeah.
Let's talk about the details on that and what people should be looking for if they're making a mask or buying a mask or wearing a mask.
Absolutely. So a couple really important points. I'm not going to be talking about N95 masks, and I'm going to show you a mask right now that looks a lot like an N95 mask. It's actually one that I've produced using surgical fabric. The N95 masks are these masks that cover in a circular fashion, the whole face. And the key to an N95 mask is you can't breathe around it. You must breathe through the fabric. That's how it provides security. Respirators are actually the plastic things with big things on them. N95 masks are not what you need to go to the grocery store. N95 masks are what healthcare professionals need if they're treating someone who they know has COVID, because that does not allow any particle through. You'll see N95 masks are also made for like the painting industry so that you don't inhale paint fumes, or for the hardware industry. If you have those, that's fine. You can use them. The one thing I will say is that some of those masks actually have like a plastic valve on the front. And
Yes,
this is
I've
the
seen that.
important point because that valve is a one-way valve. It allows you to breathe out without filtering, but breathe in only filtered. Those are much more comfortable to wear, but actually do not protect your neighbor. So just keeping that in mind when you go out. It's protecting you, but not somebody else. So this is sort of a round N95 mask. I also make these for friends and family. It's just a face covering mask, sort of nice pink on the inside. These are perfectly valid. A cloth mask is great. And a cloth mask will keep droplets from flying out into the world as you're talking or breathing or coughing. And as long as you're using a fabric that's got a small enough hole size, you should be totally fine with a mask made of that type of material. Some of the surgical masks, that are folded and sort of hook over your ear loops, those are fine as well for preventing droplets getting out into the world. They don't prevent like COVID from coming around the sides because obviously you breathe through the sides and underneath. But really, that's not what we're trying to do. We're not trying to prevent you from we're not expecting everyone to wander around in N95. Those are really only for a healthcare professional.
Awesome. Now, when you said the fabric, making sure fabric doesn't have small enough hole or the
Right.
holes are the right size, what should people look for that?
So first of all, if you can see through holes in fabric or you can see through the fabric, the holes are too big. Step one.
Starting point, yeah.
What I tell people is quilter's cotton is probably one of your best bets. So
Okay.
here's a piece of fabric, nice flowers, 2 layers of this quilter's cotton is a great mask for day-to-day use. You can
Okay.
also make these masks. There are a lot of patterns out there in the world where you can make the mask a folded mask and actually put a pocket in to add a 3rd layer. That's great as well. Here's another piece of fabric. It's a lovely piece of corduroy. I use it for pillows. It's a really tightly woven fabric. This would be great for a mask. Things like cross-stitch fabric, embroidery fabric, things like that really are too thin. Silks, things like that are really, silk can be very finely woven, but really is kind of a waste to make a mask out of.
Okay.
I see a question popped up about what kind of cotton. And so what I tell people is quilting cotton. It's these sort of a little bit thicker, a little stiffer cotton fabrics that are meant to make quilts or, you know, not really, you don't want to work with clothing materials because clothing materials are a little bit different, have some nylons in them and often have bigger holes than we imagine.
Okay, that's good pointers there. And then as far as fitting a mask to your face,
Yeah.
I know we've talked about, and I have seen as well, you know, going to the store and the cashier has their mask like on their chin, we've heard, or on their head, or like, or just below their nose. And I'm like, I'm pretty sure you can breathe out of your nose. So what should we be working?
Do breathe out of our nose.
Yeah.
So the key to wearing a mask is that it cover your nose and down to under your chin. It will probably be open at the sides. It won't be closely fitted to your face. It's just too hard to make that style of mask. Although I do offer, I did send Shannon ahead of time, and it'll come in the follow-up email, a pattern for this mask, and I'm going to put it on. So if I'll have to yell a little because you won't be able to hear me. And this one has a wire in the nose and is fairly far back and fairly fitted under here. So that actually provides a lot of protection. So it just feels more secure and feels like you're getting better protection. But like I said, it has to go over your nose, under your chin, and be held somewhat tightly to your face. If you're fogging your glasses, you're probably doing something right.
Okay.
Yes. But yes, putting it down here does nobody any good. If you walk around like this, you've basically not worn a mask. So you will not bother.
Yes, proper wearing of the PPE is.
And the other point I really want to make is that I'm, you know, playing around with these here, but when you're wearing these out in the world, and especially if you do ear loops, you should never be removing your mask by touching the mask. All the bacteria are here or here. You should always be removing things by the elastics. So pulling it off your ears or off over your head. And that should be the only thing you're touching. And the minute you take that mask off when you get home, you should leave it someplace, either outside or in your car or outdoors, and wash your hands immediately. Okay. Because if you handle the mask and then go off and eat a sandwich, you've basically not worn the mask.
Right. Good reminder there. And then what about washing the mask? Should we be washing the mask every now and then?
So if you made a fabric mask, absolutely. Okay. So the surgical masks you can buy, which are made of paper, no, you can't wash those. You also cannot microwave those. Please do not microwave those. They have metal in the nose. You will blow up your microwave. And also a lot of them are actually plastic and fabric, so they'll melt. For like N95 masks, there are instructions online how to put them in a very low oven to slowly bake to try to make them good again, but they can generally not be washed, any of those paper or surgical masks. But fabric masks absolutely can. And if you've made one with a pocket to put a filter in, then you can just take the filter out, throw your mask in the washing machine. You should actually be washing it every day or two. Pretty much, we're using them so often now that having a few masks to cycle through is great. I think I also gave Shannon a pattern for a fabric mask that you can put a filter in. So there are definitely some great options out there. And I'd love to talk about filters if you let me just roll on into that part.
Let's do it. Let's do the filter conversation.
So, like I said, 2 layers of quilting cotton or quilter's cotton is a good enough mask for the average person going to the grocery store and moving around their lives. If you want to put a filter in, that's fine. But if you're going to do it correctly. So you'll see all sorts of things that say they can be used as filters online. Any website will tell you all sorts of things. Some of the things I've seen and know to be useless are things like coffee filters. The holes in those are far too large. Paper towels, again, holes are far too large. Some things that can be useful. So if you have like those wet ones, hand wipes, if you dry them out, they actually have fairly small holes. Those can be a really good filter to stick inside a mask. What you do not want to put in a mask, and a big warning is when this first all happened, people were saying, oh, you can make a mask out of or filter with a HEPA filter out of your vacuum cleaner. Many of those HEPA filters are made with fiberglass particles. You can actually give yourself asbestos lung by breathing those in. So just to be on the safe side, stay away from all of those vacuum filters, air conditioning filters, things like that. It seems like a really good idea, but in fact, it can be quite dangerous. Okay. And also in terms of the wipes, I'm talking about wet ones or hand wipes, not bleach wipes.
Oh gosh.
Bleach wipes, even when dried out, still have some bleach in it. You don't want to be inhaling that.
Yes. Really good reminders, because it can be easy to think, I'm going to take this idea and make it better. I'm going to take one filter and make it better when that might not be the case. So
and another great, a great thing that I've seen people using as a filter, which would work great, is something called shop towels. So there's sort of a heavier duty paper towel you can get in hardware stores, meant for like heavy duty washing of hands.
Okay.
They're actually quite thick and can be a good filter.
Okay. These are good recommendations. And then as far as the patterns, I know you said you're going to send them along. Are there anything, if people wanted to look for other patterns, or are there patterns that people should avoid if they see them online?
No, I think there are a lot of great patterns out there online. And since we're not trying to generate that N95 perfectly fitted mask, there aren't really bad patterns per se, but don't take on more than you can do. If you can sew, great. Like this one that I was showing you is actually a really simple pattern where you just sew down the middle, then you sew the two pieces together, and you can even like glue wire on the outside if you don't want to sew it into the inside. I've sewn mine into the inside. And a lot of them just have little ear loops or ties. Ties are the easiest thing to put on. And this pattern is one of the resources we'll send out. One of the other resources I'll have Shannon send out is the University of Florida Department of Anesthesia actually came up with this mask. So the one that's circular, sort of like an N95, as well as a folded mask. And the patterns are really, really well explained. And so I really appreciate them. And those can be actually made quite tight and fitted if you're a little more worried or you're someone who's slightly higher risk. But, any folded mask pattern is fine. There are even patterns for how to fold over a piece of fabric like 3 times and put 2 hair elastics in it if you can't sew at all. And that's fine too, as long as you're covering your nose, down under your chin, and it's held tight to your face.
Excellent. So does that mean, there's options if you can't sew, there's options for a sewing machine. Can these patterns also be hand sewn if you don't have a sewing machine?
You can absolutely hand sew them. It'll just take a little longer. Make sure you do a good job so it doesn't fall apart as you're going about your daily work or throwing them in and out of the washing machine. But you can absolutely hand sew these. You don't need a sewing machine. Yeah, no, I mean, that's a great way to put one together.
Excellent. And we've talked a lot about masks. Obviously, that is a main component with a respiratory virus. What about things like gloves or clothing? Is there other protective equipment people should be doing? Or I've seen that people should, every time they go to the store, they should come home, take off all of their clothes and wash them. And is this sounds a little excessive, but I'd love to get your insight on this.
Yeah, that's a really good question. I don't know that we completely know. Yeah. I will tell you that those of us in the medical field, so when I go to work now, I go to work in my daytime clothes. I immediately take them off and put on scrubs. I see patients in scrubs all day. I throw those in the hospital laundry and wear my clothes home because I wouldn't see patients in my own clothes and not have to wash them. And I take a shower the minute I get home. Okay. Because I just don't know what I've been exposed to. But most of your daily activities, you're not getting that high level of exposure, especially if everyone is around and wearing a mask. So in terms of taking your clothes off the minute you get home, I think that's really about how high risk are you? Are you someone who is at pretty high risk? Then yeah, that might be a worthwhile thing to do for you. The one thing I do tell people is in your car, if you're going to go to the grocery store in your car, put a thing of bleach wipes in your car. So the minute you sit down in your car, you take off gloves if you've been wearing them, you sanitize your hands, you wipe down the car, you wipe down the bags, you do all those things so that you're just thinking about it all the time. Gloves are very controversial. And I'll tell you why. Not everybody knows how to wear gloves, how to take them on and off. So you may be exposing yourself just as much in gloves as you are without them. And I think that there are a lot of people out there who wear gloves and then think they don't have to sanitize or wash their hands. That's totally not true. Okay. And ski gloves, cotton gloves, warm gloves are not providing protection. The holes in those things are perfectly big enough for a virus to get through. So you've done yourself no good wearing your ski gloves to the grocery store. If you're wearing latex gloves, they should be put on the moment you walk into the grocery store. You can do your shopping. They should be stripped off by not touching the inside, so not touching your hands. So you strip them off from the outside, and then you use the inside of this glove to take off the other one. It's kind of hard to. So say I had a glove on this hand and a glove on this hand. I would pull this one off from the outside and drop it, and then I would go inside this glove and strip it off. So I'm not actually touching the outside of my hand. I would still then go and immediately wash and sanitize my hands. So gloves may not add a whole big layer of protection over just being cautious to sanitize and wash your hands when you get home. Because as long as you can handle all sorts of things, the virus can't penetrate your skin. It's the minute you touch your face or your eyes or your mucous membranes or your food or your steering wheel, which you then touch later and touch your face. That's really where the viral transmission happens. So if the minute you walk out of that grocery store, you sanitize, and the minute you get in your car, you sanitize, and the minute you get home, you wash your hands, then the gloves may not have added a whole lot.
Yeah, it's a good reminder. I think it's also important that you said, even with the PPE, whether it's gloves or masks, it's not a shield or a reason for us to forget the basics. So we still have to wash our hands. We still need to avoid touching our face, touching our mouth. These are just additional layers that can provide additional support. We did get a question about running. This person asked, do I need to wear a mask when I'm running? Am I being disrespectful or endangering others if I don't? What are your thoughts on that?
That's a really tough question. It depends on how crowded a place you are running in all honesty. If you are not around a whole lot of people, no, you're probably fine. You don't need to be wearing one running. There's a lot of air circulation when you're outside, especially on a breezy day. So the dilution of those particles is pretty good. But if you're running on a busy running trail and people are running all around you, or people are biking by you, or you're running by a bunch of walkers, yeah, you are kind of disrespecting them a bit by not running in a mask. As much as, and I am at baseline a runner, I understand just how uncomfortable it is to run in a mask. Like, I don't want to do it.
Right.
But even if you run in a very loose cloth mask, which shouldn't impede your breathing very much, that would be a better thing to do. It doesn't have to be a tight mask. It's just, know your surroundings. And so like when I go out walking here in Seattle, we go down to a place called Union Bay Natural Area and we walk, and there aren't a whole lot of people around. So we typically don't wear masks, but we keep them in our pocket. And if like it's a particularly excellent bird watching day and there are just people everywhere, we put them on. We're just like, you know what? There are too many people around. I don't feel like I'm being safe not wearing it.
Yeah, it's good to reminder to be aware of your surroundings, and then it is situation specific right now.
Yeah, no, absolutely.
So speaking of different situations, this question just came in that they asked, if they take a bus or a subway, is it safer to use masks with shields in those areas where you might be closer to people?
That's a really good question. Buses and subways are a tough thing because people do need to take them. Not all of us have a car or have the ability to park where we need to go, and a lot of us are essential workers right now. What I tell people is the more protection, the better. I don't often worry about a shield because I wear glasses, so I know that nothing's going to go directly into my eye. But if you're not a glasses wearer, if you have easy access to a shield, great, put it on. You're not going to hurt anything. Taking it off, again, you have to think about how you take it off. Take it off from the back, and then wash your hands because anything on the shield can infect you. But is it absolutely necessary? No. Probably the most common place you're going to pick up that virus is through your mouth and through breathing in. So wearing the face mask is the most key thing.
Excuse me, as I'm coughing. Um,
Good thing it's on video.
yeah, exactly. Well, that is helpful to know because it seems like again people might be wanting if a face shield is good, then or if a mask is good, then a face shield must be better, and then pretty soon we're wearing spacesuits
Yeah,
to
and if we had enough spacesuits to go around, I'd say go for it, but we don't.
right. We don't. We need
So
to.
think about how badly do you need that face shield, and are you taking it away from a healthcare provider who truly does?
That's another good point too. We have to be cognizant of those that really are on the front lines and are needing the support, and then doing what we can to protect ourselves reasonably.
Yes.
Well, Becca, what about purchasing masks? Are there any resources that you know of if they're like, I'm not sewing? Any organization, are you taking orders? Any
No.
organizations
I'm
that
not
are
taking orders,
supportive?
mostly because I make all my masks out of actual surgical fabric, which is N95, because I'm sending it to healthcare providers.
Excellent. Thank you for doing that.
So though I have a lot of quilting cotton, that's not what I'm making masks from. No, but there are people who are gearing up and really making them in large volume now and starting to sell them in places like Etsy and eBay and things like that. What I would say is I wouldn't think that you need to go to like China and buy N95s. You don't need that level of masking. Look what's available in your community. There are a lot of people who are making them in volume now. And, a lot of folks who have sewing skills are currently unemployed. And if, you have fabric but no skill, maybe look on your local neighborhood community thing and say, look, I've got fabric but no skill. Who's got skill but no fabric?
There you go.
We pull this thing together and
Yes.
make me 4 masks and you can have the rest of it. There are great ways to barter for it or look online for someone who's making them. I think a lot of people I've seen selling them recently on like Facebook groups and things.
Excellent. Yeah, and it's helpful to know what to look for with those, and they ask them what type of fabric they're using and provide them recommendations if they're using fabric that have larger holes in them.
Exactly. And I think most people are making it out of quilting cotton. It's all the printed cottons that you see, the florals and the checks and things like that. That's mostly what I'm seeing pop up in those groups. People know what to make it out of.
Are there any red flags if people are looking online of, myths, things that people should look out for when it comes for PPE, maybe websites that someone might be looking to take advantage of people and require or telling them they should buy things that they don't need,
Right.
things that people should keep in mind that are red flags and be consumer savvy?
There has definitely been a lot of fear mongering, especially at the beginning of this pandemic when we really didn't know what was going on. So like I'm saying in this whole webinar, you just need a simple folded cloth mask. You do not need anything else to keep yourself safe and keep others safe unless you are a healthcare provider or someone who's working day to day in and out with the public, in which case your employer should be providing your personal protective equipment. And that's an important point as well. You should not be responsible for your own personal protective equipment if your job is to face the public. So, look for something. It should not be expensive. You do not need 100 of them. It does not need to be an N95 or a respirator. I know a lot of those people were trying to buy those when this first came out because we just didn't understand the virus enough. But now that we have some experience, a simple cloth mask is enough. You don't need to get something any more elaborate than that.
We have another question that came up on the filters. And if you could review the type of material you recommend using for a filter, and this they specifically asked, does Pellon work? And if so, is there a certain thickness that should be used?
I have to look up what Pellon is. So you all have to bear with me because that's not one I know.
Pellon.
Pellon. Pellon is interfacing. Gotcha. Interfacing is probably not, it depends. Interfacing has many different thicknesses and weaves, but I'm guessing interfacing is probably not tightly enough woven. The fusible interfacings are often actually although it looks tightly woven, they're not all that tightly woven. So I would guess no, although I haven't specifically looked that one up. So the two that I have seen that are fairly easily available and probably good enough are, like I said, the wet ones type hand wipes, which are dried out, and shop towels. If you cannot get those though, and I cannot emphasize this enough, 2 or 3 layers of quilting cotton is a sufficient mask. It's a tightly woven fabric. It's probably actually more tightly woven than the interfacing, depending on the interfacing. So you're probably doing better just by adding an extra layer of that.
Keep it simple. Back to the
It's
basics.
simple, yeah. You don't need severe filtering because you're really breathing out the side of the mask anyway.
Right. Yeah. And you still want to be able to breathe too.
Right, but more importantly, unless your mask is so fitted that no air can escape below, on the sides, or above it, then that you're not breathing through that filter so much. It's more of a barrier to the droplets.
Okay, great. Anything else that you can think of right now, Becca, that we could offer our participants in terms of what they're looking for, final closing thoughts on this topic?
I think the biggest key for me as parts of this country are going to start opening up is a couple key ideas to keep in your mind. We have not all gotten COVID-19, which means we are still going to get it. The reason parts of the country are opening up, and there are many reasons why parts of the country are opening up, I'm not going to go into the politics of it, but the reason some folks feel like it's safe to start opening up is because the hospitals are not as full. They're not opening up because COVID is gone, or we have a cure, or we have a treatment. They're opening up because there's space in the ICU for you. And that's a really important thing to think about. So continuing to protect yourself and others, especially fragile or vulnerable people, so that we don't get that peak, a second peak again, is really key. And, wearing a mask out in public is only partly about protecting yourself. It's really about respecting and protecting others and those who have to go out but are fragile. So, for example, my mother lives alone. She is medically more fragile than the average person, but she has to do her own grocery shopping. So I thank anyone who goes to her grocery store wearing a mask to protect her, because it's the only thing we can do for each other at this point.
Yeah, it's such a good point of it's more about other people, and we're all in this together.
Yeah, and we can continue to protect each other by taking small steps. Many of us are going to have to go out. We're going to have to go out more and more because there comes a point where you just have to get groceries or go to work. But we can do it in the safest possible way. And those of us who don't have to go out should stay home, even if the orders get lifted. Don't go out to party. Don't go out to hang out with your friends. Go out if you need to go to the store. Go out if you need to get something. Go out if you need to go to work. I totally understand those things, but staying home is still the safest thing you can do to keep this nice level contagion rather than getting another spike.
Yeah, another good reminder. Outside of the PPE, if you're staying home, you also don't need to wear a mask. So,
as we evidence, since we're talking to each other and we can see our lips.
Exactly. Excellent. Well, Becca, thank you so much for all this information. It's really helpful to have your medical insights, especially since you're working in the field, maybe not COVID specifically right now, but who knows what's to come.
Anyone of us going anywhere near a doctor's office or a hospital are working with COVID at this point, because you can't ever be sure it's not there.
Well, thank you so much for doing that and taking that risk and helping us understand how we can decrease our risk.
Those in the medical profession, thank all of you who wear your masks to the grocery store, because you are keeping us safe as well.
Yeah, team effort here. And then finally, do you want to share just a little bit more about the telemedicine we offer with Gennev on the OBGYN side that you oversee, so our listeners have more information on that?
I am happy to. So our telemedicine is now available in 48 states and the District of Columbia. And what we generally offer are board-certified obstetrician gynecologists and some nurse practitioners and one naturopathic doctor. And all of us have an expertise in menopause and women in menopause. So as OBGYNs, we can do sort of the basic stuff. We can talk to you about a urinary tract infection or your general health. We understand some primary care, but our focus is really on helping you to live your best life in menopause or perimenopause, or manage the symptoms that come along with those things. And so we love talking about those things, and we're happy to either consult, we can prescribe, we're there for you.
Awesome. And you can book an appointment with any of our telemedicine providers on the book appointment link on our website. And we also offer the Health Fix program. That's the health coaching program that I direct. And working with a health coach, I work with my clients on lifestyle strategies that can help manage symptoms around menopause. And often it's a collaboration. Most of the clients I see are working with an OBGYN to manage if it's hormone replacement therapy or medications or the symptoms on the medical side of things. And then in combination with the lifestyle strategies is really where people tend to get the most benefit, where they're working on both sides, so medical and lifestyle, to be able to support optimizing their health and feeling their best right now. So.
And that's really key. Like the way that we're able to work in conjunction with each other at Gennev is really key, because you have OBGYNs always available to ask questions if something's coming up. If you think a patient needs to see someone, we're there for them. And we have you as a phenomenal resource when we're telling patients, hey, the best way to manage this is really by addressing fitness and nutrition. Because they felt we have somebody who's really, really good at those things and can be your support and your accountability and give you the best possible hints specifically tailored for you.
Exactly. And there's text-based communication and email in between the calls, so you're not alone. We provide the support, and it's multifactorial, multidisciplinary, and so it really helps women to be successful and feel better right now. And it's a challenging time, but we're here to support you.
Yes, it is a very challenging time, and honestly, just having someone you can reach out to when you're feeling a little bit low and contemplating that third glass of wine is probably a good thing.
Yeah, exactly. I'm here for you.
There you go.
Also, well, thank you, Becca. We will follow up with a recording of this. So if you know someone that could benefit, feel free to share this information with them. And we'll also follow up with the resources that we mentioned here in the webinar. And then finally, on Thursday, speaking of exercise, I will be talking with Robin Jones, who is a Bar 3 studio owner. And we're going to be talking about, the title is really fun, and I think you'll want to hear the story behind it, but why Bar 3 is the workout that Michelle Obama's generation should be considering. So we'll be talking with Robin about that, learning more about one form of movement and exercise that could be beneficial. So tune in for that. That is Thursday at 1 p.m. Pacific time, 4 p.m. Eastern time. So
and if you tune in for that, you don't actually have to do a Bar 3 class at the same time.
Exactly. Yes, it's not an active class. It will just be a conversation, but we'll have resources that if you want to do Bar 3 in the future, you'll be able to. Thanks for pointing that out. We might get more people, or we might get less people by telling them they have to exercise. So, well, thank you, Becca. Thank you all for joining, and we will look forward to seeing you at our next webinar.
Excellent. Thank you, Stacey, for hosting this.